Continue to track the growing number of cases of COVID, there are concerns tonight about the ability of our local hospitals to treat everyone who would need it should the virus become even more widespread. The chief medical officer at Penrose St. Francis spoke with reporters today about this very issue and the plans that local health officials have in place. The top doc at Penrose Hospital calming fears about the spread of COVID-19 and the ability of our hospital network to handle a widespread outbreak.
It's something that we're able to tier with contingency plans to really meet the need in partnership with the rest of the hospitals across Ventura, as well as our community partners.
He says there's no reason patients who've currently scheduled operations or treatments should fear coming to the hospital.
I can certainly understand it from an emotional standpoint, but with all of our precautions, we keep our patients safe, and we would never put patients in harm's way.
The health department and our local hospitals are working together to create backup plans in case large numbers of COVID patients all show up at once. In Italy, where more than 1,800 have died in just a few weeks, one of the biggest problems has been a lack of hospital beds and a shortage of healthcare workers. On Friday, Governor Polis announced plans to expedite licensing of healthcare workers who've already been licensed in other states, and he asked retired doctors and nurses to consider returning to help with the outbreak.
Several people have reached out and just offering their services. I, for one, am not currently practicing, but otherwise would step in to help. And starting tomorrow, Penrose, like UC Health, will also limit the number of visitors to their hospitals to just one person per patient. Again, anyone with a cough, cold, or fever symptoms or symptoms of the flu will not be allowed. And these rules are following guidance from the CDC and the Colorado Department of Public Health and Environment.